Hello, everyone. My name is Constance Mancia, and I am a licensed practical nurse, and I have been for 35 years now. Throughout my career, I have worked in several areas of healthcare, and I have witnessed many depressive episodes, both in patients and with my coworkers. During this time of social distancing, it is a privilege to be able to virtually bring you this most important information. This morning, I would like to welcome all my healthcare professionals, and I encourage you to listen with an open mind. On today, I will be speaking to you on depression and its actual physical pains. Yes, you heard it correctly, physical pains. According to Harvard Health, a publication from Harvard Medical School, more than 50% of depressed patients who visit general practitioners complain only of physical symptoms, and in most cases, the symptoms do include pain. Other studies suggest that if physicians tested all patients with pain for depression, they might discover 60% of undetected depression. Most people see depression as a condition of the mind, and that has been proven to be true. However, depression may present itself in several ways. The CDC explains that one might experience aches, pains, headaches, or even stomach conditions that do not improve with treatment. And even though the patient might deny depressive episodes, many of these cases are merely the manifestation of depression. One might also find it interesting to know that physical symptoms are typically reported at least 50% more often by women than by men. Some believe that it is the result of how men associate physical ailment with being weak or feeble. And this could possibly be the reason why men tend to shy away from seeking medical advice or attention. The CDC also acknowledges the increase of depression among the elderly. Some estimates of major depression of older folks living in the community will range from 1% to 5%, but rise to 13.5% in those who require home health care and to 11.5% in older hospitalized patients. As we can see, no one is immune. As we all know, the brain is quite complex, and each person is unique in how his or her brain can and does function. This will often explain why some folks may exhibit depression in more classic ways, such as poor self-care, insomnia, and feelings of guilt and worthlessness, to only name a few. Now keep in mind that the exact cause of depression is unknown, and while gathering research, that shocked me. BeyondBlue.org states that researchers suggest continuing difficulties, long-term unemployment, living in an abusive or uncaring relationship, long-term isolation or loneliness, prolonged work stress, and an unsettled home life are more likely to cause depression and can be crippling if not addressed. There has been many scholarly books and articles written on this subject, and most will give credit to genetics, the environment, and other psychosocial and psychological factors. Once we understand this concept, it is not too far-fetched to understand that depression can sometimes manifest as pain, as well as other discomforts, and sometimes without our even knowing it. So having now been informed of the other side of depression manifestation, do not quickly dismiss a person's complaint of gastric discomfort, skin eruptions, or other outwardly seen symptoms. Take the time to assess the whole person. Should you ever encounter anyone who openly admits to having episodes of depression, please encourage them and make them aware that there is help waiting. Mentalhelp.net is a 24-hour, 7-day-a-week help center phone line where depression is taken very seriously. There are volunteer professionals there mandating the phones and are waiting to give a caring ear and offer resources. Thank you for listening. I am Constance Mancia, LPN, and I thank you for your time.